Today I want to talk to you about Lyme disease. Lyme disease was first described in 1977. Lyme disease is the most common tick-borne disease in the United States, Canada, and Europe. Lyme disease is a spirochetal infection caused by Borrelia burgdorferi. The bacteria is usually carried by an infected tick, known as the isote tick. The tick subsequently bites the individual and transmits the spirochete into the blood. Patients are at risk for Lyme disease if they are from or have traveled to an endemic area. In the United States, the primary endemic areas include Connecticut, Delaware, Maine, Maryland, Massachusetts, Minnesota, New Hampshire, New Jersey, New York, Pennsylvania, Rhode Island, Vermont, Virginia, West Virginia, and Wisconsin. The clinical stages. The clinical manifestation of Lyme disease can generally be divided into three phases. First, early localized, secondly, early disseminated, and thirdly, late disease. Early localized disease is characterized by the appearance of the skin lesion erythema migrans, with or without constitutional symptoms. Erythema migrans is a rash that appears at the site of the tick bite, usually within 7 to 14 days after the bite, but may take up to 1 month following the tick bite. Some persons may present with flu-like illnesses. Then we have early disseminated Lyme disease. Early disseminated Lyme disease manifests as acute cutaneous problems, neurologic problems such as radiculopathy, cranial nerve palsy, and peripheral neuropathy, lymphocytic meningitis, and cerebral or cerebellar ataxia. Lymphocytic or monocytic meningitis alone or in combination with cranial nerve or spinal nerve root involvement represents the most common form of nervous system involvement. Meningitis usually occurs several weeks to a few months after the tick bite and may be the first manifestation of Lyme disease. Cardiac involvement, such as second or third degree AV block, may be present. All these symptoms usually occur weeks to several months after the tick bite and may be the first manifestation of Lyme disease. Late Lyme disease. Late Lyme disease occurs months to few years after the onset of infection and may not be preceded by a history of early localized or disseminated Lyme disease. In the United States, arthritis in one or a few joints is the most common feature of patients with late Lyme disease. There may also be a subtle polyneuropathy or encephalomyelitis. Months after the onset of infection, about 60% of patients develop joint swelling and pain. The diagnosis. Serologic testing for antibodies to the spirochete, Borrelia burgdorferi, should be done. Then there is also the two-tier strategy, which is recommended by the CDC, and it typically uses a sensitive enzyme-linked immunoabsorbent assay, ELISA, and this is followed by a Western blot or a second ELISA with different targets. If the ELISA is positive or equivocal, then the same serum sample should be tested by Western blot. If the initial ELISA is negative, the sample needs no further testing. The treatment. The first-line treatment is doxycycline, 100 milligrams orally twice daily for 10 days. Or another regimen could be amoxicillin, 500 milligrams orally 3 times daily for 14 days. Or, if that's not available, cefuroxime, 500 milligrams orally twice daily for 14 days. A pregnant woman with Lyme disease should be treated with amoxicillin or cefuroxime. Well, thanks for listening and supporting this video. Some of the material presented today came from UpToDate. Please support them. And again, thanks for listening. Please don't forget to like, share, and subscribe. I wish you well. Good night.